Republican senator from Wyoming, doctor, and Senator John Barrasso.
Is he okay?
I think he'll be fine.
All right, are you sure?
You're worried about melanomas? He's awfully tan,
yeah.
24.
All right, if you could give us a diagnosis.
Yeah. Might want to talk to him
Is
about
Senator
that.
Boehner right, though? Will this not pass?
I think there's a huge roadblock ahead. As you said, the president couldn't even explain it to George Stephanopoulos. You know, the president's popular, but his plan is not, and people understand it. It's complicated.
But is it even his plan, though? I wonder whether the president even understands exactly what's in there, because there's so many different bills out there right now.
And in his speech, he kept saying, my plan, my plan, my plan. I said, let me see your plan, Mr. President, because the guidelines that he sets out don't really apply to the House bill. They don't apply to the Baucus bill. They don't apply to what came through the Help Committee. And there are, 564 amendments for the bill tomorrow morning in the Finance Committee.
Is there a health care reform bill that comes from the Baucus bill that you could support?
Not at this point. No, you know, he's talking about funding so much of this through the states. They want to raise Medicaid, put more people on Medicaid, which is the program even the people that have it can't see a doctor, so it's just putting more people into a sinking ship. So I think that's the wrong way to go, to say they're going to save all these hundreds of billions of dollars on Medicare, the program for our seniors. You know, we're now 8 months and a day into this administration. The president has not appointed somebody to be in charge of Medicare, or even a deputy. The last person left when George W. Bush left office. 8 months and there's nobody in charge of Medicare, a program that spends $1 trillion a year and covers 100 million people with Medicare and Medicaid. Nobody's in charge, and that's not a sustainable program.
Do you agree with that they ought to stop and restart this whole process? And by the way, is that politically realistic?
Well,
it's just a way to get a roadblock into it doesn't happen.
I think you have to look for things that work and what the American people think ought to work, which is let people buy insurance across state lines, deal with all this lawsuit abuse.
But that would take quite some time, and then politically it will not happen. You know that.
But Mika, the bill that the president's looking at now, all of these bills out there, none of them start taking health care until 2013. What they want to do starting today is start collect the taxes. They're going to collect taxes for 10 years and only give services for 6. That's the gimmick that they're using to do this budgetary thing where they say they can pay for it in 10 years.
Mike Barnacle.
Senator, you're a doctor.
25 years as an orthopedic surgeon.
We have an internist issue in this country. There are too few interns. My question to you, is there anything in this bill that provides for more interns and provides for how they get paid?
Not internists, family physicians, pediatricians, all of the primary care physicians. You know, we need to do more in terms of also nurse practitioners, physicians assistants. There's a disproportionate way that physicians and healthcare facilities are paid for now in the United States. We pay more in the United States for doing things.
So does the Baucus bill address that?
I don't believe it does. It adds more money to the system, but I don't think it actually reforms healthcare.
So I hear you correctly, Senator. It's good to see you. You want that people should be able to purchase health care across state lines. Does the co-op idea not achieve that that's contained in the Wyden-Bennett or even the Baucus bill?
I'm not convinced that it takes it all easily in. Well, what they put $6 billion to set up a co-op. Why do we need to spend that money? Just let people buy insurance across state lines.
But whether it's $6 billion or zero, will it allow people to buy across state lines? Because I happen to agree with you. I think that I'm just trying to figure out what Mika said. You have buy across state lines, tort reform. And what else do Republicans need in the bill for Democrats? Because I think it's unrealistic. I think we're going to start over at this point. The president may be forced to, but probably unrealistic. What are the 3 things Republicans need, the 2 or 3 things Democrats that you can live with that can pass?
Yeah, well, I think the big things that people understand are buy insurance across state lines, deal with all this lawsuit abuse. You know, the whole thing ought to be aimed at getting the costs under control. And people right now understand that it's going to cost them more if you go poll the American people, and they believe that.
What are the Democratic ideas can you live with?
Yeah. I believe that the people ought to be able to keep their insurance when they change jobs. Because our kids are going to change jobs 6 times. I think the pre-existing conditions you shouldn't be excluded because of that. I think if somebody has insurance, they shouldn't be kicked out when they hit a maximum.
So insurance reforms.
All right.
Yeah. Okay.
Senator Barrasso, thank you very much.
Coming up next.